That there have been no new deaths in the country, and the toll there remains at 3,331. The National Health Commission saying there were 32 new cases in China. All of them, they said, had been imported. Now, that comes in marked contrast to what's been going on in Spain and Italy. We've got the situation there with the two countries having seen nearly 30,000 deaths and 265,000 confirmed infections during this pandemic. Having a look at Italy, those numbers are shocking, but they did come out and report the lowest number of infections in nearly 3 weeks, and that's prompting debates on how and when the country should start emerging from a nationwide lockdown, which appears to be working here. France out with a continuing levelling off of cases, Paris signalling that confinement measures are indeed starting to contain the crisis. Elsewhere in Europe, Denmark joining Austria in announcing a gradual relaxation of measures imposed to slow down the spread of the coronavirus. The country there will press ahead with a cautious reopening of kindergartens and primary schools. That could happen as soon as the 15th of April. But of course, it has a caveat, and that is that the virus numbers should remain stable up till then. Chancellor Angela Merkel saying in her first news conference since returning from 12 days of self-isolation that it's too early for Germany to set a date for easing its lockdown. And as you've been reporting as well, New York Governor Andrew Cuomo saying deaths from the pandemic were showing signs of hitting a plateau in New York, which of course is a state which has become the epicenter of the U.S. outbreak. Guys.
Rish, it's a different story in the UK right now. What's the latest on Boris Johnson?
Well, it was about 9 hours ago, just over 9 hours ago, that he was transferred in St Thomas's Hospital in London to the intensive care unit there. Officials say that he is receiving oxygen, but is not on a ventilator. All of this against this barrage of questions that have been asked of the government there as it heads into a possible peak of the pandemic in the UK. The Prime Minister is fighting for his health in the ICU, his government under pressure to get to grips with the outbreak. We got UK deaths, though, slowing down for a second day, but people are still saying that the cases will climb over the next 7 to 10 days. And the country does remain in lockdown. Health services are trying to fill shortages of vital medical equipment. Now, Dominic Raab, the foreign minister, has taken over the helm there of power, I should say. The decision to hand over power to him was taken after concern in the cabinet and among MPs that Johnson should have been resting instead of working. It also does come amid suggestions that the seriousness of the prime minister's symptoms, including a persistent cough and high temperature, were underplayed by himself and his aides.
And in Japan, Rish, we saw record stimulus to help the economy, but now we're awaiting possibly an emergency to be declared sometime today.
Yeah, it could be. And we've got Shinzo Abe, the Prime Minister, set to unveil details of this record stimulus package worth close to $1 trillion as he tries to stop the economy there and entering into a free fall. And if you do some of the maths here, half of Japan's economy is set to enter a state of emergency. The government strengthening its response to the pandemic, deepening fears that output could plunge by as much as 20% in the current quarter. He's also going to be announcing a lockdown of or an emergency declaration for Tokyo, Osaka, and 5 other prefectures, empowering local authorities to urge people to stay at home for 1 month. They may not actually be able to get out of their houses properly and walk around freely until the end of the Golden Week holiday, which could be the May the 6th. So the emergency declaration is set to cover Kanagawa, Saitama, Chiba, Hyōga, and Fukuoka prefectures there. And currently that's all done to empower local governments to try to contain the spread of the virus that, of course, causes COVID-19. And, of course, one of those measures would be forcing residents to stay at home.